Right.
So here is another question from Priya. So yeah, it is about Cushing syndrome. So what she wants to know is Cushing syndrome an hormonal condition? What are the potential causes of Cushing syndrome? And how can a patient get tested for the syndrome?
Very good question. Yeah, it is unfortunately under-recognized. Cushing syndrome is a hormonal disorder specifically caused by prolonged exposure to cortisol levels. This can be various factors, including the body making too much cortisol because of an ACTH overproduction by the pituitary gland or a CRH production by the hypothalamus, or a body adrenal gland making too much cortisol because of either a tumor, which can be benign or sometimes can be cancerous, or another cancer that making too much cortisol, or a person taking too much steroids for different conditions. Like, for example, a patient has asthma, they need a lot of steroids, or if they have certain autoimmune conditions that needs steroid replacement. So excess exposure to cortisol to the body is Cushing syndrome. But again, the symptoms can be from weight gain, especially around the abdomen and face. They'll have thin arms and legs. They can have muscle weakness, fatigue, easy bruising, high blood pressure, high blood sugar. It can be tested by checking a cortisol level, where we do something called as midnight salivary cortisol, or we check a 24-hour urine cortisol, or we do a test called as dexamethasone suppression test, followed by we do scans of the adrenal gland or the pituitary gland, or, for example, if it is a smoker or if it is certain cancers that producing cortisol, then we need to further investigate by doing whole body scans. But again, they are very rare, but they can happen as well. Yes. And it can be treated very easily. I mean, it's unfortunately, you need to see a specialist for this. There are newer medications that we can use to treat them, or to remove the cause of that excess cortisol, which is usually by doing surgery on the adrenal gland or the pituitary gland.
Okay. So thank you for that insight, doctor.